Dr. Bebo here. Let's do our medical term of the day. And today I have another weird one. Uh, and I mean, it's an interesting concept. And if you think about it, it'd make your head warp. But that is the syndrome, the alien hand syndrome. The alien hand syndrome is a mental disorder or a neurological disorder where you have no control over one of your limbs and it acts on its own, basically. There are five different subtypes of alien hand syndrome. The first one is called diagnostic dyspraxia. That's when your hand just acts independently, and the actions that it does are in direct opposition to the actions of your other hand. So if you, with your right hand, are unbuttoning your shirt, your left hand might come in behind it and button your shirt back up. If you're using one hand to pull down your pants, the other hand may be trying to pull up your pants. That's beyond weird. There's the alien hand sign. That's another subtype. That's when you believe that your hand's not your own. You do not recognize it as being part of your body. There's the anarchic hand syndrome. That's sort of like diagnostic dyspraxia, but it doesn't have necessarily oppositional movement. It may just be off doing its own thing, and you have no control over what it's doing. Then there's the subtype called the supernumerary hand, where you just feel like you have an extra arm or extra hand. And then there's the levitating hand, and that's where you're just sitting there minding your own business. All of a sudden, your hand goes up. You can't control it; it just does it. So there are several things that can go wrong here, and I can see some very awkward situations because with the anarchic hand syndrome, when I said it has a mind of its own, it does. It can reach out and grab something and not let go of it, no matter what you try to do, and you might have to use your other hand to try to pry your hand loose. I can see you getting in trouble like that if it reached out and grabbed the wrong thing. So this kind of problem is very, very rare. Some surgeries that can cause it, deep brain stimulation. Sometimes to treat epilepsy, they have to go in and cut a part of your brain called the corpus callosum. And the corpus callosum is the communicating part of the brain, which lets the left side communicate with the right side. If they cut that, then one side doesn't know what the other side's doing, and it can cause this kind of syndrome. Brain tumors can do it, strokes, injuries, those kind of things. If it happens in the right area, can cause these kind of problems. The typical areas are the frontal lobe and the parietal lobe of the brain. There's no cure. Um, Sometimes they spontaneously go away and don't last very long. Sometimes they last a very long time. They've tried different medicines, seizure medicines, and things like that to various degrees of success. So, if you have a weird neurologic problem where your hand doesn't do what you're telling it to do, then that's called the alien hand syndrome.